So
Um,
30 people have joined. I think we should start. Rajesh sir,
okay.
Sanjay sir.
Sure.
Yes, please.
Good morning,
Okay.
KK.
Good morning, sir. Yes, sir, good morning.
Yeah. So we'll start with the session for today. Good morning, everyone. Uh, PG Psychiatric Education Committee welcomes you all in yet another session of Scholarly Sunday of this year 2026. I'm your moderator for this session, Dr. Saili Dabera. I am an assistant professor at KMSK GMC Chandrapur. I'm honored to welcome our president, Dr. Mishra sir, our chairperson, Dr. Gawande sir, our faculty for this session, Dr. Dume sir and Dr. Kumawat sir, and all the dignitaries who have joined us today for the session. So, as we all know, certification is a critical skill that bridges clinical practice and the legal responsibilities. So, today's session is aimed at refining your this skill. So, with this, I would like Dr. Mishra sir to kindly give his presidential address and share his perspective about certification in psychiatry. Over to you, sir.
Hello, good morning. Good morning,
Good morning.
Sushil, Ashil, and all the members of the Saturday, Sunday, and the PG committee members, and our respected Kumawa sir and Dhume sir. And for the residents, I think those who are already in the second year and third year, they must be knowing what is the importance of certification in psychiatry, either in the for the civil cases, for the for the any criminal cases in the several occasions. When you become a qualified psychiatrist, you have to give the certificate. Either the person has to make a will, or the person is involved in some criminal cases, or even for the absentees from the office, or for the fitness certificate. The several occasions, including even mental subnormality and autism, also you have to give the certificates. So certificate is a very important aspect in psychiatry, and we have got two senior members who are for the almost for 3 decades, 3 to 4 decades, they are dealing with this certificate issue, and they are the authority on this, and they will guide you how to make it, how to like what are the intricacies and what are the difficulty you may faces. So all these short introduction, I'll request Sally to carry forward, and wish you all the best. And I think this will be a learning experience for all of you. Same also will appear in your examinations. Either sometime you may get a long question and also in certifications. So with this, I wish you all the best. And please, Sally, carry forward.
Thank you.
Thank you so much, sir.
Thank you. Thank you.
Yes. I now request Dr. Gawande sir for his remarks on the topic, please, and to guide us through the flow of the session. Thank you,
Uh,
sir.
th- Thank you, Saili. Am I audible?
Yes, sir. Yes.
So, respected Dr. Mishra sir, our faculty, Dr. Kumawat sir, Rajesh Dhume sir, our moderator Saili, and all the participant students and other students. First of all, thank you so much, Kumawat sir and Rajesh Dhume sir, for accepting the invitation and sparing your Sunday morning with us. Thank you so much for that, and I thank Saili also to take out for taking out the time to arrange this session so wonderfully, and be in communication with the faculty and the students and the person who is preparing flyer. Thank you so much, Saili.
Thank
Without
you.
a further ado, let me honestly confess that I have done so many mistakes in writing certificates, even after passing MD, even after doing a job as a lecturer in a foremost institute like JJ Hospital, where every day and night we used to write the certificates. So once back to the practice, in the emotions of the relatives, in the emotions of the known people who are known to us, in the emotions of the medical colleagues, have written some certificates which I repent even today. So just with their request, writing if a schizophrenia is there, and then if the request is there, then writing nervous illness, and if suppose bed rest is not required, but if the someone very close to us is calling us and then just giving a bed rest and then trying to explain that university or that department with the to and fro emails, so I still repent. And I think those were the mistakes during first 6 months of the practice, or maybe 6 to 8 months of the practice. And later I realized that writing certificate is something very serious, and here we need to learn where to say no than to say yes. Wherever, if we can safely say no, that protects us. And if in the friendship and in the good faith, if we say yes to everyone, then it becomes a problem. So I thought these two senior faculty, Dr. Kumawat sir and Rajesh sir, would be a right person for this session. So thank you so much, sir, and I request Siley to proceed with the today's session. Thank you so much.
Thank you, sir. So we'll proceed with the session now. We'll proceed with the formal introduction of our esteemed faculty. Dr. Sanjay Kumawat sir. Sir is a director at Insight Mind Care Center, Thane. He is a consultant psychiatrist at Hiranandani Hospital, Jupiter Hospital, and also Fortis Hospital, Mulund. Sir is a member of Maharashtra Rural Health Unit. He was a former mental health director at Government of Maharashtra. Sir is a member secretary of State Mental Health Authority, Government of Maharashtra. He is a medical superintendent at RMH Thane. Also a member of Anti-Narcotic Authority, Government of Maharashtra. I welcome you, sir. Our second faculty is Dr. Rajesh Dhume, sir. He is a senior psychiatrist at Government of Goa since 2001 to date. He is a nodal officer at National De-Addiction Treatment Program, Goa. Sir is leading a 10-bedded detoxification unit in Goa. He is also a former president of IPS West Zone from 2018 to 19. He has been former president of IPS Goa State Branch. Sir is a member of National Task Force for De-Addiction. He is a master trainer at Substance Abuse and Suicide Prevention. He co-drafted the Goa Mental Health Policy in 2003. Sir he has contributed also in Suicide Prevention Project for Goa in 2024. He is also a founder member of Dementia Society of Goa. We welcome you, sir. Should we proceed with the session with the permission of seniors?
Yes, yes.
So to begin with, just for the introduction, the medical certificate is a document stating satisfactory medical examination by the dictionary. So MCI has allowed us, the medical practitioners, to issue the certificate at the request of patient and or the court order. So psychiatrists and other mental health professionals like psychologists or the other mental health workers are usually requested to issue a certificate related to admission, treatment, administration, the legal proceedings, or the welfare measures and benefits. So this is a list which I found in one of the articles where it is stated that what certificates can be given by whom. So medical board together as a unit can issue all these certificates like fitness, unfit certificate, fitness certificate, disability certificate, certificate for adoption. Then there is a certain certificates which can be given by state mental health authority and the psychiatrist. That includes treatment certificate, capacity for consent, capacity to make advance directives, capacity for certificate to fitness to resume the duties, treatment certificate. Most of these certificates we'll be discussing in today's session. So I'll like you to go through the articles. I have provided the reference below. Next would be I'll be talking in brief about disability certificate in my talk. So I would like to share that the disability certificate itself is a very vast topic and very detailed one. So I'll be just touching upon the important aspects of the topic. Everything is taken from the gazette provided by the RPWD Act 2026. So RPWD Act 2026 has changed multiple aspects in the previous act of 1995. It has increased 21 categories of disability from which were only seven in the previous act. The act emphasizes on persons' rights and the accessibility to get the certificate. So what comes in rights? The right, it is the right to equality and opportunity, to inherit and own the property, to home, the right to home and family, and reproductory rights. Uh, So, in accessibility, what do I mean by accessibility is to have the access to uh, infrastructure and the transportation to where the patient would get disability certificate. Uh, the Act has also increased the reservation for people with disabilities in government jobs from 3% to 4%, and in higher education from 3% to 5%. So we'll be looking one by one the psychiatric aspect of RPWD Act, which involves neurodevelopmental disorders and the mental health disorders. In neurodevelopmental disorders, we'll be looking into intellectual disability, also called as global developmental delay if the child is less than 5 years. So, if the child is less than 5 years, after assessment with all these IQ tests like VSMS, BKT, uh, if the child is less than 5 years, we'll apply VSMS and will certify the child as global developmental delay, and whatever the disability is calculated, will be certifying that disability to the child. Now it is advisable or mandatory even that the child should be reassessed at the age of 5 years again if the child was less than 5 years, and if the disability was more than 80% at that time, then the next assessment should be at the age of 18 years. If the disability was less than 80%, the child can be assessed at 5 years, at the age of 10 years, and at the age of 18 years. So, the certificate which the person would get at the 18 years would be considered as permanent. This is the table which denotes the disability percentage according to the ID level. So, profound ID has 100% disability. Severe ID would be getting 90% of the disability. Moderate ID would be having 75%. Mild 50%. And the borderline would get 25% disability certificate. Moving to special learning disorder disability. So, as we all know, special learning disorder is a difficulty in processing language, whether it is in verbal or written form, and can also be associated with calculation difficulties. So, when the child comes to us in the medical facility, he should be get checked by the pediatrician, and by the other facilities like ophthalmologist, the ENT doctors, um, the occupational therapist, the clinicians, us psychiatrist and the pediatrician would be ruling out the intellectual disability. That is, if the child has the IQ more than 85%, he'll be assessed further for special learning disorder, specific learning disorder, and he should be assessed for any visual impairments, any hearing impairments, or the psychiatric comorbidities, including emotional and behavioral disorders. So, only after ruling all this out, we can go ahead with the assessment of specific learning disorder. So, also, you should keep in mind that the child has adequate opportunity for learning and is also getting enough motivation for learning from the surrounding. Going with the assessment of specific learning disorder, the Gazette has suggested an enhanced battery assessment. When we assess if the child has three standard deviation below the performance, three standard deviation below the class performance, he is considered as a patient with learning disability. And the second one is grade level assessment device. So if the child is scoring less than 40% on GLAD, then the person can be certified with SLD. Uh, so to get the certificate of SLD, the child must be more than 8 years old, and the disability which reflects on the certificate would be more than 40%. When the child is in 10th year, usually we get the patients when they are in 10th or 12th year. But if the patient is come and has received before 10 years the certificate, then the child should be assessed in 10th, 10th standard of his scholastic career, and also in the 12th standard. After the age of 18th year, the assessment and the certificate would be considered as permanent. Next one being autism spectrum disorder. Autism spectrum disorder again is a developmental disorder with difficulty in social understanding and language, sometimes difficulties. So when the child comes to us, will the psychiatrist and the psychologist, the team, the board would be assessing the child for autism spectrum disorder. Below 6 years of age, the child is assessed through Ames Modified Incline Diagnostic Tool for ASD. So I would request the participant, the students, to go through. It is available in the Gazette and is very insightful and very elaborate test for the assessment. Also, after the age of 6 years, ISA, Indian Scale of Assessment of Autism Score, is applied for the child and the disability is calculated. Here is the table denoting the disability percentage according to the ISA score. Now, mental illness. Mental illnesses are assessed by Indian Disability Evaluation Assessment Scale. So it has four components. Please go through the detailed scale, and the mental illnesses which are covered in this according to Gazette are schizophrenia, obsessive compulsive disorder, dementia, and bipolar disorders. So the patients would be getting certificates, but the benefits they require would be getting when the disability is 40%. But you cannot deny certificate for the patient if it is below 40% of the disability. Before issuing certificate, we have to make sure the following things, like documents from the private practitioner should be there with you if the patient is not treated by you and has come just for the certification. you will get under treatment certificate from the practitioner he was under. And the treatment received is advisable for at least 3 months. So in the first, temporary certificate is given, and when the psychiatrist feel gazes the disability because of mental illnesses, the person can be given permanent disability certificate. Obviously, after the age of 18 years, it can be given. So I have these certificates which we have issued to the patients. I'll be sharing my screen. Yeah. So is the certificate visible? Hello.
Yes, yes.
Yes.
Yes, ma'am.
So yeah. So this is the certificate we issue to the patient. The patient has to be registered under UDID facility. Patient would be getting the unique UDID number. Here, patient's photograph is pasted. Then the patient's details are mentioned, like his name. Here you can see this is to certify that we have carefully examined the patient's name. Then his relation with the informant, the daughter of, the birth date is mentioned, and the personal details are mentioned, the registration number, residence, and then the illnesses details are given, like mental illness, the part affecting his brain, the diagnosis, and the percentage of disability is notified. Now, in this case, we have issued a temporary certificate for this patient, and it is as the date of issuing is 25. We have issued the certificate for 2 years here. Now, the patient is requested to renew the certificate before the validity ends. Okay, so the next certificate is intellectual disability certificate. Similar way, all the personal details and the uh, photographs and everything. Here in disability certificate, we give the percentage as we have calculated with the help of VSMS. Uh, Now the person has received permanent certificate here. So the person is moderate intellectual disability and is 75% disabled according to the assessment. So here, after the detailed assessment, and the person must be above the age of 18 years and with the significant disability, we have given a permanent disability certificate for the patient. The next one is the LD certificate, SLD certificate we have received. So the child was yet 16 years old, and hence he has received 2 years certificate. And now, so the temporary certificate, as you can see, the disability percentage mentioned is more than greater than 40%. So the child would be renewing the certificate again in the 12th standard. So these were the certificates of disability. We make sure the disability assessment is as perfect as possible. We assess the patients thoroughly, and then at the end of the assessment, we issue the certificate through the disability board. So if senior permits, I will go with the introduction of our participants. Now participants would be presenting their certificates and will be having the insights of our experts on that. Should we proceed, sir?
Yes, yes, yes. Please go ahead.
Sushil, I just want to bring to the notice of the students some of the
Yes,
things
sir.
that we actually miss uh, teaching our students, which I have realized over the
Yes,
period of time. First and
yes, sir.
foremost, you should understand that certificate is given to either an institution where a person is employed or an institution where a person is studying. That is called as a
Yes, sir.
personal certificate. And when you say certificate, certificate is stating only one fact: illness, fitness, uh, capacity for trial, capacity for will. It has to be only certifying one particular aspects, and we make a mistake of trying to add unnecessary details which go
Exactly.
against several other rules of psychiatry. That is
Yes.
number one. I have seen certificates using beautiful calligraphic fonts. Please understand, if you see all the certificates that Saili showed, the certificate has to be in Arial. The calligraphic series by codes is Arial. If you are giving it to an institution, the font size should be 12. And if you are giving it as a report to the court, the font size should be 14. If the font size is 12, 1.5 should be the gap between two lines. And if the font size is 14, it should be double uh, gap between two lines. Why is that so? Because if the judge tomorrow shows you your certificate and you are in the Kathera, you should be able to read from that distance that yes, this is my certificate. Because he's going to hold it up to you. He said, Doctor, did you give this certificate? You have to say yes or no. If you can't read because of the font size, these are some practical things that I have painfully understood. The other thing is that only prof yeah only
No, sir.
professional only professional certificates like MBBS and all in the British times were permitted to do use a script called as the brush script, which was a so sometimes we write certificates to beautify. We cannot write certificate to beautify. They have got legal or quasi legal value. If you're writing a certificate to an institution, please write below not valid for legal submission. Or it is on the interest, you should write down it is on the application of the patient. If patient is asking, be sure about that because sometimes patient takes and he submits to something else, you are unnecessary into a situation. This is my opening statement. Thank you.
Yeah, thank you very much, sir. That was very useful. Even in our practice, we come across multiple court orders, and we have to give in a similar format as you have mentioned. Thanks a lot, sir. So, our participants for today would be we have six participants. The first would be presenting the certificate for joining back to the duty. Fitness to join back to the duty. Dr. Divyang Golani, he is a JR2 from JNMC Medical College, Savangi Meghe, Varda. Next, we have Dr. Mayur Sadhwani. He is a JR2 at KMSK GMC Chandrapur. Uh, the third participant is Dr. Shweta Parmale. She has completed her MD Psychiatry from GMC Chhatrapati Sambhajinagar. Next, we have Dr. Akruti Kachara from People's Medical College and Hospital, Bhopal. She is a JR3 there. We have Dr. Anushka Kumar, JR3 at Lata Mangeshkar Hospital, Nagpur. And last but not the least, we have Dr. Shreya Petalia. She is a JR1 at GCS Medical College, Hospital and Research Center at Ahmedabad. So I welcome all the participants and all the very best for your presentation. A few things I would like to notify that the total time you would get for your presentation of the certificate, and followed by the discussion would be around 7 minutes. So you should complete your certificate presentation in say 4 or 5 minutes, 4 minutes, if the discussion has to be effective, and then rest time would be utilized for the discussion. So I hope every participant is there and is able to hear me properly. Yes, so we'll move ahead with Dr. Divyang. Are you here,
Yes, ma'am.
Yeah. So I'll be sharing your certificate. Please go ahead with your presentation.
Okay. Hello, everyone. My name is Divyang Gorani, and I will be presenting a certificate of fitness to resume duties. We'll be presenting a case of a 28-year-old married Hindu male who was working as a bank employee, but because of an acute psychiatric illness, he was on leave for 3 weeks. So patient came to the casualty, and after a comprehensive assessment, he was diagnosed with acute and transient psychotic disorder as per ICD-11. He had persecutory delusion, third-person hallucination, and irritable behavior that had caused frequent altercations at work with other employees and customers. After 1 week of hospitalization, patient's symptoms subsided and he was eventually discharged. Patient came to OPD 2 weeks after the discharge for regular follow-up and informed to the doctor that his employer wanted a certificate stating that patient is fit to resume his duties as a bank employee. On evaluation, the patient showed a resolution of the psychotic symptoms. The MSC was clear, and the patient had returned to the baseline functioning. As a result, patient was considered fit to resume his duties, and the certificates were given. So this is the certificate. In this certificate, as you can see, you will start with this. This is to certify that Sri X, age 29 years old, with identification mark this and this, is under the treatment of this institution. Patient requires a certificate for fitness to resume his or her duties as a bank employee. At first, he visited this institution on 4th February 26. After comprehensive assessment, he was diagnosed as acute and transient psychotic disorder according to ICD-11. He was admitted on 4th February 26, and then he eventually discharged 1 week later on 11th February 26. He attended this OPD again on 25th February, accompanied by an informant, Srimati Y. The informant is the wife of the patient. At this date, patient's mental status was examined. The history, the present status of the patient's illness were collected by interviewing the following persons and reviewing the following records. So first, we took the account of wife to see if there is any improvement in the patient's psychiatric symptom and adherence to the medication. The previous medical and psychiatric records were also examined. Patient's work history and level of functioning at workplace before the onset of this illness was also examined. Following the above steps, it was found that patient doesn't have any overt psychiatric symptoms that will interfere with his duties, with his ability to fulfill his duties as a bank employee, and therefore he is fit to resume his said duties. And eventually, the signature of the patient informant and the medical officer was given. Certain additional statement regarding the certificate is that because of the nature of the psychotropic drugs, patients should avoid night duties, and because inadequate sleep can precipitate the psychiatric illness. I can think if their duty involves the use of firearm, then because of the nature of the psychiatric illness, they should be avoided. And the third is initially, patient should be reintroduced to his or work gradually. And if his work requires precision or accuracy, the work should first be under supervision before giving independent duties to the patient. Okay, ma'am.
Okay. Yeah, thank you, Dr. Divyang. I would request our experts to kindly give their inputs about the certificate, please. Over to you, sir.
Divyang,
Yes, sir.
what was asked by the bank?
Uh, Whether or not patient can resume his duties or
So
not.
has asked for fitness, right?
Yeah, fitness.
What are all these other details doing in your examination, this visit, that visit, this medication? Has the bank asked you that?
No, sir.
You are the expert. You are the treatment doctor. You have made a diagnosis. You have treated
Mm,
it. You have taken
mm,
all information from the informant, which is a part
mm.
of your medical examination. It has nothing to do with the bank. When you go to the
Yes.
bank, does the bank tell you how you are getting your withdrawal from
No,
your
sir.
account? Does it tell you what buttons it is pressing on the computers
No,
to
sir.
make an entry? Those are
No,
their
sir.
technical issues. आपको क्या मांगता है? पैसा मांगता है ना? वो आपको पैसा
Mm.
दे देंगे. उसके पीछे वाली स्टोरी लिखने की क्या जरूरत है?
Okay.
Fitness is simple. Patient XYZ, aged so and so, with so and so identification mark, has been examined by me and as far as and has been found to be fit on this day for resumption of his duties as a bank employee. That's it.
Okay, sir.
Nobody asks you what is your how you have come to the fitness, what was his past experience, where was what was he treated on, what symptoms he came. That is not, this is not a report you are giving to the court.
Okay,
This is
sir.
a certificate. Short, simple, and to the point. This is my observation.
Thank you.
Well, about your contention about writing those things like duties, firearms, and other things. As far as duties are concerned, you just say that the patient is on sedatives and he may get sedation at appropriate time. That's it. You are not supposed to mention that he should be avoided night duties, etc. It is none of our business to say that he should not be avoided. Yes, about
Okay,
fire,
sir.
sure. Firearms, you may say that such patient is his behavior had been like this, and in future, till further notice, he should not be allowed to use firearms. Till further notice, it should not be forever or etc. You have a bracket over there, right? And then,
Yes.
as Dr. Dubey rightly said, that be very precise. You don't write essay. Be very precise about what is asked to you and answer related to that. Not beyond that, not be under that. You get it?
Okay. Yes, sir.
Good.
Thank you, sir.
Thank you, sir. So just to add, the participants should be giving a background related to the certificate they are presenting. Uh, so we'll move ahead with the next certificate. Dr. Mayur, please join us.
Good morning, everyone. Am I audible?
Yeah.
Yes, you are.
Good morning. I'll start my presentation for the report and the certification of capacity for a patient who was admitted under us. The First of all, the context of the case, it was a 49-year-old male who was admitted in our hospital for the psychiatric assessment, and a report and a certificate stating his capacity to stand trial was asked for by the court of our district. So in our certificate, first of all, we start off with a covering letter in that wherein we mention the date and the outward number from our department or the hospital wherein the certificate is being issued, and it is addressed to the judicial magistrate. And we first give out the subject that this is a covering letter which is showing the assessment report of the person, Mr. X. The details of the patients have been withheld. Then we move on to mentioning the references via which we have got the correspondence from the prison or the superintendent of the jail asking for the capacity assessment. And then the covering letter is generally signed by the head of the institute which is currently practicing over there. In our case, since it was a letter addressed to the district hospital, so the civil surgeon was the one who signed the covering letter for the same, and the report and the certificate was enclosed after that. Now, coming to the main part, which is the report. First of all, we mention the date of the generation of the report and the registration number of the patient when he was admitted in a ward, and then we mention again the references on basis of which we are providing the report, And then while in the report, we start off with the basic demographic profile, wherein we identify the patient based on his age, the gender, the name, the language which they speak, the identification mark, and that he has been in the prison since the date when he was in the prison, and then the prisoner number, and now why he has been admitted in the GMC Chandrapur, which were due to the psychiatric evaluation, and the evaluation was necessary because he was presenting with symptoms of talkativeness, big talks, and having irritability and sleep disturbances, and thus a capacity assessment was required by the court of law for his trial. And then we were assessing him serially, so the serial MSc and the history was noted down, and brief details of it, which were taken by his wife at the time, the OD, were mentioned in the report, wherein that he had a previous history of depressive episode in year 2021 and was given medication for the same. And then we move on to the stay in ward and the serial MSCs which we see, and we also mention the verbatim, like for in our patient, we could observe that he had all the features of mania on his MSc, wherein he had delusion of grandiosity, he had increased psychomotor activity, and he had prolixity, circumstantiality, and also his verbatims with respect to the delusions were mentioned, wherein he said that there are people who are trying to harm him, there are people in higher up positions who are trying to kill him. And after mentioning that verbatims, we move on to the basic lab investigations which were within normal limits. We mention those, and then we move on to the treatment which we provided to him, which were the antipsychotics and the mood stabilizers. And then we move on to the concluding or the actual certification part, wherein as per our assessment we give out the diagnosis, which was at the time F31.2 as per ICD-10, and that we also give state that he was not having the capacity to understand the nature of the proceeding and charges against him, but that too at that point of time we cannot certify that whether or not while the crime was being committed he had the capacity or not, or did he had the mental illness. We can only certify that whether or not he had the capacity currently, and that what could be the line of management wherein with treatment and ECT he could be made fit to stand trial, and his capacity could develop. And then we provide the final uh, mention wherein that he should be given regular medication, and this report and certification is to be signed by two psychiatrists who are practicing in the hospital, and also mentioned should be the details with respect to the same. Thank you.
What did the court ask you?
Capacity to stand trial.
Why is this details required by the court?
Firstly, there was a requirement of a report, and also whether or not the person has the capacity. So,
Right.
inside
Did the court ask you report?
Yes, sir, report and
So
capacity.
you have to just report, no? That my report is that I have done this, I have done this. There's the technical details you should carry to the court. And if on how did you come to the conclusion that he was so and so, then you have to answer these questions that I did this, I did that, and that's how I. How do you know that he has got capacity? You have to answer this. This report is absolutely correct, but this is not something that you will give the court because court has asked you one question: does he have capacity to stand trial? Your answer is, I have examined him, and at this point of time, person has the capacity to stand trial. That's it. Because if you give these details, the opposition lawyer will get all the information. He will call you into the katera and start asking you various questions, and your poor client is going to get disillusioned. He's going to go back into his problems. Why do you say it is depression? Why not something else? How are you sure that it is by F31.2? These type of questions will come. He's asked you capacity, na? The report karo. We have done all sorts of medical thing technically, and we find at this point of time, person is fit for trial. That's it. Suppose you say that he will be on treatment fit for trial, which means he's not fit for trial at this point of time. He may be fit in the future. At the time of, did the court ask you? This the court will ask you in the court. Doctor, what do you feel at the time of doing this crime? Was he mentally ill or he was mentally stable? So at that question, you will answer that, sir, right now in my examination, I find him to be mentally stable. However, I cannot say how his mental state was at the time of committing the crime. These are all statements that you should make. These are my experiences. Sanjay might have something else to add.
Well, this is classical example of how not to give certificate.
Exactly.
And firstly, you have got a lot of unnecessary details. You have used medical jargon. The judiciary does not understand. You have talked about the medicines and other things which are given. The judiciary is not interested in doing what you did on your end. Number two, also, whenever giving such details to the, whether even to the court of law, if unless ask, don't breach the confidentiality about the patient's. As Dr. Dume rightly said, the person on the other side, he may take advantage of whatever information you have provided and may use against the client or the patient. Number four, the format itself. Be very precise, be very short, and to the point. Don't write an essay. You're not supposed to write an essay and a love letter to the court of law. If they said capacity, talk about your provisional diagnosis. He doesn't have capacity, in my opinion, to stand trial. Or finish. Your whatever you have written acts as your evidence if you are caught. That acts your objective report if you are caught. You are not supposed to provide unless it is asked for. As Dr. Dubey said, if you are called for trial, you may submit everything. But everything meaning if they ask. Unnecessary also in the court of law, don't utter anything unless that question is asked. And be very precise in answering questions also in court of law. Don't give a big speech there. And even in writing a certificate, it has to be very precise. Your start was excellent. You gave a reference to which you are responding. But the rest, that essay was not unnecessary. Thank you.
Thank you, both of our faculty. Just because I have seen this patient in my institute, so the order from the court was actually to assess the patient thoroughly and admit the patient if necessary. And as he was having all the symptoms in the jail itself, uh, he was sent to us, and that's why we gave this.
Assessment is your provisional diagnosis. That's it.
Yeah.
No
Yes.
symptoms to be given. No ad verbatim report to be given. No
Sure, sir.
treatment needs to be given. Court doesn't understand poor judgment. Court doesn't understand insight. Court doesn't understand your medical jargon, disorganized behavior, etc. Why you have to write all these things? Big talks and talkativeness. No. Not necessary.
You have
Okay.
given his jargon also, which is a privileged in communication between you and the patient. Tomorrow, the patient will sue you and say that you exposed me unnecessary in
Do
court
you
by
know,
saying.
do you understand prolixity, circumstantiality, region of God? Your certificate is a classical example of over inclusion.
Sure, sir. We'll keep that in mind and we'll
Please.
correct. Yeah.
Because unnecessarily we
Yes,
do
sir.
not want to fall in the trap because the judiciary is very high-handed. The advocates, they make a mess of it, make of us, or our innocence, you may say, or our lack of understanding of the judicial process. And we don't want to make mockery of ourselves at the court of law.
Sure, sir. Thanks a lot for your insights. Next, we'll proceed with the next certificate. I'll request Dr. Shweta to join us, please. She'll be presenting a testamentary capacity certificate. Dr.
I'm
Shweta,
Dr.
are you here?
Shweta.
Yeah.
Yes, ma'am. I'll be presenting a certificate on testamentary capacity. To begin with, following is the clinical scenario. Mr. T, a 75-year-old retired businessman with history of hypertension controlled on medications and no other major medical or psychiatric complaints, wishes to create a will to distribute his assets amongst his two sons and a daughter. Due to advanced age, his lawyer suggested obtaining a testamentary capacity to avoid future legal disputes regarding the validity of the will. After careful evaluation, the following certificate could be issued the to Mr. T. Uh, this is to certify that I, Dr. ABC, have assessed the testamentary capacity of Mr. T at XYZ Hospital. After a detailed assessment for 2 weeks, it is observed that Mr. T is of sound mind, no evidence of any active psychopathology is found at present, and has the capacity to make a will. Mr. T knows that he is making a will and he is making it voluntarily without any undue influence from others. Mr. T is aware about the extent of his assets and potential beneficiaries, contents of the will, and consequences of his decision. Impression is that Mr. T is fit to make a will, followed by signature, date, and place. So this was the extent of the
Very
certificate.
good, very good.
Lot of things are missing here. It is not only
Yes,
external influence. You talk about the course, you talk about the drugs influence. You also talk about they are not interested in any psychopathology. You write down patient is conscious, that patient
yes,
is cooperative, that the patient has the patient is well attentive. Why you are writing sound mind? Please put it on paper because you need to justify this. Why he is of sound mind? You are not written the date. If I mistake, not the time of that certificate. Time is more important than the date. Even time is very important. Number three, you also write. Please don't scroll. I'm reading the certificate because while talking, please just next, please. Next, please. Next, please. Yeah. Uh, there is no necessary he wants to make will, etc. The next is absolutely right that after this he understand the scope of his property, the extent of his property, to whom it's to be given and why. Because he may give it to out of 4 sons only to one. So that why is important. It is not
yes,
only that he wants to give it to people, but why he wants to. He can justify that suggests your capacity also. That why he understand. So that you have asked that suggests. So this has to be put on paper, all right?
okay,
So in my opinion, he has a capacity to do a will. That's it, a valid will. That's it. Okay, and
yes, sir.
witnesses sign. I guess you are second.
Witness
Just
is signed.
scroll up. Witness is not there. Witness
Oh,
is not
witness
there.
is not there.
So,
Witness
so
is
I
good.
have a question. Do we need witnesses sign on the testamentary capacity
The
or the will?
witness need not be beneficiary. The witness has to be unrelated with the patient and need not be beneficiary, but on the certificate.
On the certificate. Okay, sir.
Please. Okay?
Two
Good.
Yes,
witnesses
sir.
are required for will.
Yes.
For the will. Yes, sir. But on
Not related,
testamentary
not
capacity, only
related.
one is okay?
No, no.
It is better what Dr. Dume said. You make the thing foolproof when you have two people.
Yes, sir.
And as it would be ideal if one of them is a lawyer
Okay, sir.
or a legal person.
Yes, sir.
Okay.
See, when you go to register the will, the registrar will ask you only two questions. Have you read the will? Do you know why you are giving what you are giving to whom? You say yes.
Yes.
Have you read the will? You say yes. Have you read the will? We will read it again in front of these witnesses. Number one, are you related to Dr. Dume? No. Who are you? I am so and so. Second person, are you related to Dr. Dume? Is Dr. Dume, did you include him in your will? No, sir, he is not a beneficiary. So you need two people. First, capacity. You should understand that he is of sound mind. You have to say, because the judge will, this one will say, I find him to be of sound mind and his will may be noted down.
So I have one question because it's related to capacity, but not necessarily will making. So can I
Yes.
proceed?
Yes, yes, please.
Sir, if we have a patient with severe dementia and suppose they're admitted at a hospital and their family members need an FD, a fixed deposit that is under the patient's name. Most of the times this happens that patient is not able to sign the document or from the bank. What do we do in such scenarios? What kind of...
You are supposed to give to the bank a letter related to the capacity of the patient,
Yes, sir.
that he is not in a position by virtue of his mental illness diagnosed as dementia.
Yes, sir.
That's it. Now, what the bank does after that, whether he has nominated somebody, etc., is none of our business.
Okay.
Or whether the money remains stationary with the bank, that they have to do. Why we should bother? We just certify
Yes,
to the bank that he is not in a
has
position to
dementia.
understand because of this particular illness called so and so. That's it.
In this case, only an application from the family is sufficient.
Sorry.
In such a scenario, only an application from the family, is that sufficient, or do we need to
Yeah,
involve
yeah.
some
No, you don't have to take an. Get a letter from
legal
bank.
route?
No.
Yes, sir.
Ideally,
Okay.
it is the primary caregiver who, incidentally, according to Mental Health Care Act, is the nominated representative,
Yes, sir.
generally speaking.
No, the bank
Yes.
rules are different.
Bank rules are obviously, he will say the
Bank will
nominee,
go by
nominee.
their rules, not by MHCA.
Yeah, not by us.
Okay, sir. Understood.
Okay. Thank you. So we'll move to our next certificate. Dr. Akruti would be presenting long-term admission certificate. Dr. Akruti?
Yes, ma'am. Am I audible?
Yeah.
Yes, you are.
Yeah. Okay. Good morning, all respected dignitaries. Today in our session, we'll be learning about a very legal and clinical certificate that we as psychiatrists must know for better transparency between the system. So, as we are familiar with the MHCA 2017 Act, I would like to mention some background behind the Section 90. So, in the MHCA Mental Health Care Act 2017, they have clearly mentioned about the rights of the person with mental illness and for their caregivers. And they have mentioned about the treatment, admission, and the discharge processes as well. So, what happens with the admission is that there are certain categories in which a person seek admission in a mental health establishment. He can seek with the retained capacity under voluntary admission 86, and when if the patient doesn't have capacity to make mental health care decisions related to his well-being, then he is required to take admission with high support need. Okay, so that comes under two sections. The section 89, which is admission with high support need up to 30 days, and the next comes the section 90, when the continuous admission with high support need is required beyond 30 days. So when to apply section 90, it kicks in when the person who is already admitted under section 89 still requires further inpatient care for his well-being, or if any patient who has recently been discharged and requires readmission within the 7 days. The condition is that he should be admitted under section 89 only for getting readmission under section 90. So in these two cases, we admit a patient with mental illness in our mental health establishment only after assessing the patient. The most criteria is that the patient doesn't have the capacity to make a mental health decision, and a nominative representative or an advance directive should be there. So, in the MHCA Act, Mental Health Care Act 2017, they have provided the form F, Rule 8 for that. Under that, they have provided the form that the nominated representative or the advance directive will fill about the details mentioning the nominated representative documents, ID proofs, and present to the medical officer in charge of the medical health establishment. When the medical officer in charge received that form, then he ordered the assessment of the patient by the two psychiatrists. So before certifying a patient to admit under Section 90, he has to be independently assessed by two psychiatrists either on the same day of admission or within the 7 days of his admission, right? Then both the psychiatrists will form their reports stating the present condition and about the past condition also, how he behaved or how his or her symptoms aggravated or worsened that warrants the further inpatient care. So we'll see the structure of the certificate that after assessment of the patient, two psychiatrists have jointly came to a conclusion and will form a certificate, and that certificate with the adjoining documents like the reports of the patient's medical records, the ID proofs, and the nominated representative or advance directive documents will be submitted to the board. So we'll see the certificate that the psychiatrists jointly have prepared. I'll read it for you. That to the chairperson in the Mental Health Regulatory Board, respected sir and ma'am, mention patient name, age in years, gender, with the nominative representative details mentioning the name, age, and the relation with the patient. Admitted on, if the patient is admitted under Section 89 previously, then we have to mention the date, have been examined independently by the undersigned psychiatrist on the day of examination should be mentioned here, but certify that patient is suffering from schizophrenia 6820. Here we need to write about the diagnosis as per the ICD-11 criteria, and the patient has consistently over time threatened or attempted to cause bodily harm to himself. Second, has consistently over time behaved violently towards another person. Third, has consistently over time shown an inability to take care of himself independently. So a point should be noted here that the word has consistently over time is defining the symptom pattern over few days. Okay, it is different from section 89, which defines recently, means the current episode. But in section 90, they have mentioned about has consistently, means the pattern is so severe that is necessitating inpatient care. And most important is the next line, currently lack the capacity to make informed mental health care and treatment decisions. At present, the patient is not in the capacity to make willful or rightful decision for him. So, these symptoms are severe enough in nature and degree to warrant further inpatient care, which would be provided in the least restrictive resources available for the necessary treatment and ensure the patient safety. We therefore jointly recommend the extension of inpatient admission under Section 90 of the Mental Health Care Act 2017 for a further period of 90 days, subjected to regular review. Okay. Then both the psychiatrists have to sign that form, and after signing by the psychiatrist, they have to countersign it by the medical officer in charge of the mental health establishment, and there are few documents which we have to attach with this. That is the medical records of the patient, the joint reports that both the psychiatrists have prepared, and the documents for nominated representative and advance selective. And this, in case of female, we have to present to the mental health review board within 72 hours. And if the patient is male, then we have to submit it within the 7 days. Okay. Then that is not that that is after submitting to the mental health review board. The review board will review the documents and will revert back either within the 7 days or maximum up to the 21 days. Okay. Then after that only, if review board grants you permission to take inpatient care, then the patient got admitted and still progress upon the medical and treatment plan. But that is also not enough. Even after admitting, we have to assess for the mental capacity in every 15th day from the day of admission to check the patient has regained the capacity or not. If the patient has regained the capacity for making willful treatment plan, Then we transferred the patient's section from 90 to the 86, that is the independent or voluntary admission. And if still the patient doesn't have the capacity to make willful treatment plans, then we'll continue with the section 90 for further days. Maximum the board will provide on the first instance is admission up to 90 days. But if still patient required further inpatient care, so on the first extension, by repeating the same procedure, we can again go to the mental health review board and demand for further inpatient care. Then he will provide the extension up to 120 days for the first extension. Okay. Then if still after 120 days the patient needs admission, so on the second extension we can ask for further inpatient care and that would be for provided up to 180 days. Okay, so this is the process for which we have to be very precise and very transparent for making it legal among the systems and be watchful for it every step to assess the mental capacity for the patient and ensure that the safety plan or the community discharge plan must be ready. So because in today's time the focus is mostly on the community based sector to develop patient social skill and social cognition. So we have to plan for the better outcome in the after being discharged also. Thank you. Sir.
Thank you, Dr. Akruti. I would like to request seniors to kindly comment on the certificate.
There's nothing much to discuss because it is very well put and as per the MHCA guidelines. She has included everything wonderfully. I don't know Dr. Dume has any opinion on this.
Dr. Dume, sir, would you like to share some comments on the certificate?
Is
I don't think. I think it's very complete, and but we should be a little careful when we ask for extensions. And sometimes, please be aware that many a times there's a slight pressure from the family to keep the patient, but always look from the point of view of patient's rights. Because if the patient attains premorbid level, sometimes the NR say that मुझे काम पे जाना है, थोड़े है और सर उनको रख दो, देखने को घर में कोई नहीं है, all these type of things are there. But then the patient's rights have to be also looked after. It's well written, very well, good.
Thank you, sir.
Okay. Thank you, Dr. Akruti. Now we'll move ahead to our next certificate. It is related to POXO. I'd like Dr. Anushka to be here and kindly proceed with your certificate. Thank you. Dr. Anushka.
Anushka,
Hello.
unmute yourself.
Hello, ma'am. Am I audible?
Yeah, now
Yes,
you
yes, you
Presenting a case of 16-year-old female, Miss APC. She was referred by a police constable on request by an officer from Child Welfare Committee with her mother as a guardian for assessment capacity and for psychological status of a child. So this child resides with her parents and she is in an urban setting and she is currently studying in 10th standard and she has been performing adequately in academics prior to this incident. Her developmental milestones are appropriate for her age. The narrative about the alleged abuse incident was, as per the patient, she reported being sexually abused by her friend's father when she had visited her friend's home one night prior. She had managed to run away and to approach to a nearby police station who contacted her family and an FIR was filed. As per the informant, the mother said she was not present, but she reports that the patient, she was missing, she was not at home for 2 to 3 years at the time of the alleged incident, and that she had mentioned going to her friend's house. Since the incident, the mother noticed behavioral change in the child, like disturbed sleep and episodes of crying. So when the police got the patient for psychological assessment and for psychological status and capacity assessment. So medical and forensic examination was done with the patient's permission in the presence of the mother, and it was conducted by a female RMP. The age estimation was also done by general physical and radiological exam, which shows that the biological age is consistent with age on the birth certificate. So after detailed evaluation assessment, a POXO psychiatric evaluation report is created, and that is submitted to the police, who will make a final report to the court. So, ma'am, in this certificate, in this evaluation, demographic details like name of the child, age, the FIR number, the date of the evaluation, and the who has requested, either the police constable or the child welfare committee, that is mentioned with the support person. Detailed narrative about the incident, that alleged incident, from the patient and from the relative, with her detailed past history. So on mental status examination, it was found that she's conscious oriented. She was appropriately dressed, maintained minimal eye contact, appeared anxious, spoke in soft but audible tone. Subjectively reported feeling scared, restricted appetite, preoccupation with the incident was noted, and judgment concept were intact with partial insight. So standardized assessment findings, IQ assessment was done using the Wechsler intelligence scale for children, where the score came out to be 91, which is average. Scales were applied for checking for depressive and anxiety features. So HAM-D scored showed 24 and HAM-A showed 10. Also, a psychological test like CAT and ROR were applied. This exhibit features suggestive of psychological distress following a traumatic experience. So the clinical diagnosis was kept as acute stress disorder. So the recommendation to the court. Ma'am, can you scroll down? Recommendation to the court was that initiation of trauma-focused psychological counseling, and a child should also not be confronted with the accused during the testimony, and parental guidance. And suppose if the alleged incident has happened in the home, so to provide a non-threatening environment to the child, and also school support and risk assessment for suicidal ideations. So after this, the declaration and fitness to testify has to be given by the psychiatrist. So here I've said that I hereby certify that this evaluation was conducted in accordance with the Mental Health Act 2017 and POXO Act 2012, and the model guidelines for recording of evidence of vulnerable witness. The findings are true to the best of my knowledge and professional ability. After assessment, it was found that the child has normal intellectual capacity and can understand and respond to questions coherently, and distinguish between truth and falsehood, and has adequate capacity to provide a reliable account of events and understand the nature and consequences of alleged act, which is capable of participating in legal proceedings with appropriate support. So, sir, like as a psychiatrist, we do not give there is no pro forma or there is no fixed format, but we will just give an evaluation to say that the child is intellectually, she has on capacity assessment, she is mentally sound, and her statement is can be reliable, but it does not, we cannot give a final conclusion whether the act has happened or not. And we will just, based on the psychological assessment, whether it is matching with her statement. So that is.
Firstly, if at all I'm a judicial officer, I'll prosecute you for recommending me what is to be done and what is not to be done. It is a contempt of court for recommending recommendations to the court of law, number one.
Okay.
Again, this is not a certificate. This is a report. You are asked to provide assessment report about the mental health of that patient. Write a report. The report should be in format. There should not be any format. So, in my opinion, she's suffering from, you have been not asked whether the act has taken place or not. It is none of our business to prove or disprove. Our report has to be that she is under severe trauma. Then there is some medical jargon you have used there. If you can scroll up about wait, declaration. Wait, up, please, up. these coils and all this. This has to be out. This has to be out.
Okay.
This has to be out. The past history, all has to be out. Unnecessary lot of details. Go down, go down, go down, go down. Because this is your data. This is your data, objective evidence. This will remain with your office, and you will just talk about what is your diagnosis. That's it. Mental assessment. She is depressed. She is traumatized. That's all. You don't have to comment whether she has. Nobody has asked you capacity. Nobody has asked you whether the victim was really the act took place or not in relation to the victim. Nobody has bothered to ask you why you have to write about it, comment about it, and never dare to recommend the court of law. It's a contempt of court, please.
Yes.
Yeah. These first demographic details are all right, but rest of the things are unnecessary.
Yes.
Dr. Dume.
Yeah, I agree with Sanjay's submission that it's unnecessary. I do not know why we add. These are your notes. These are your confidential notes. What has happened in history and whatever. I mean, if I ask you, Anushka, what is your name? What
Yes,
is your
sir.
answer?
Anushka.
You won't say that
I
it
am
was the so
Anushka.
and
My
so date
father's
of my
name is so
birthday.
and so. You will say, my
Exactly.
father's name is so and so. My mother's name is so and so. He works here. We stayed in so and so. I studied till. Are you going to say that?
No, sir.
Question is, what is the mental state? You are a mental professional, mental health professional. You are a POXO case. And when you say I, please avoid single person thing. In a POXO's assessment, it has to be a team assessment and not a singular person assessment. That is number one. You have said I in the statement that you have given last. You should say we. We, the assessing team, find the child in a psychological distress due to an alleged incident that has occurred on so and so at so and so time. Person currently is having acute stress disorder. Period. Finished. Signed by
Okay.
you, the other doctor, and signed by an administrator. You have to have three people. You have to have two assessors and one administrator, so that it is a proper team and you have done a proper assessment. Forensic वाला आया था, gynec वाला आया था, pediatrician वाला आया था. Nothing needs to be mentioned. Correct me, Sanjay, if I am wrong.
Perfect. In fact, in your team, you need to have MHP, mental health professional. So you can have psychiatric social worker, you can have psychologist, you can have another psychiatrist as your resident, etc. But
ये जो आपने बताया ना, these are procedural ways of how a POXO
this
case
you
has to be
keep with
handled.
yourself. You have done excellent job. You keep with your record.
ये MSc का डिटेल्स लिखना जरूरी नहीं है. They are your personal records.
Absolutely.
Okay.
Okay.
Good.
So yeah, thank you, Dr. Anushka. We'll move ahead with our next certificate. Dr. Shreya would be presenting an under treatment certificate. Dr. Shreya.
Yes. Good morning, everyone. Am I audible?
Yes, you are.
So the clinical scenario for this is something of a 21-year-old Hindu female college student, Miss ABC, uh, who presented to the hospital with low mood, crying spells, and pain in the lower limb. And she was admitted for the same in the hospital for a period of 5 days. And she had requested for an under treatment certificate to avail leave from her college for that period of time when she was in admission. So the certificate goes like this. This is to certify that Miss ABC, age 21, gender female, with the registration number and the informant's name and relation to the patient with the identification marks, who first visited GCS Medical Hospital on the date that she visited, The patient is on treatment since the date that she visited, which was 7th of March 2026, to the last follow-up of hers, which was on 18th of April. The patient was admitted from 7th of March 2026 to 13th of March 2026, and the diagnosis may be written with due consent of the patient. And lastly, the certificate needs to be signed by the consultant psychiatrist as well as the medical officer of the hospital. And the superintendent, mentioning the date, place, and the registration number of the consultant psychiatrist.
Okay. You are done presenting, Dr. Shreya?
Yes, yes, ma'am.
Sure. I would like our seniors to kindly comment on the certificate.
No comments from my side.
This is asked by
Dr.
whom? Shreya, this is asked by whom? Certificate is asked by whom?
The certificate was asked by the patient and the informant in order, as in it was asked by the college to the patient, and then the patient applied to the hospital for the certificate.
So she was absent from college?
Yes, yes. During the period of admission, she was
From
absent.
which day to which day? X to Y.
Yes.
So why are you
From
mentioning that she was admitted on this day, discharged on this day? What is the relevance there? You are giving a treatment certificate now. Is the patient still under treatment?
yes, sir. The patient is under OPD follow-up.
So she is sick. So you are giving a sickness certificate. You are giving a
Yes.
sickness certificate to the office now. Suppose she had typhoid, what you would give? School will ask a sickness certificate. And after she is fit, fitness certificate. Fitness is to resume college. Sickness is to be away from college. Right?
Yes.
तो अंडर ट्रीटमेंट है, कहाँ ट्रीटमेंट कर रही है, क्या ट्रीटमेंट कर रही है, जरूरी है स्कूल को? नहीं जरूरी है. राइट. सो जरा स्क्रॉल कर लो सर्टिफिकेट अप. ये आइडेंटिफिकेशन मार्क्स ये सही है, बट इज इट रिक्वायर्ड टू नो द इन्फॉर्मेंट्स नेम हियर? कौन इन्फॉर्मेंट, क्या इन्फॉर्म कर रहा है? मदर, हु इज आस्किंग द सर्टिफिकेट? इज द चाइल्ड above 18 or below 18?
Above 18.
Above 18. If the child is above 18, she has all the right to ask a certificate herself. She's in college. Informant name
Yes.
क्यों? Informant आपको जरूरी है ऑब्जेक्टिव और सब्जेक्टिव हिस्ट्री लेने के लिए. सर्टिफिकेट को जरूरी नहीं है. आइडेंटिफिकेशन मार्क्स फेयर इनफ. ये फर्स्ट विजिट डेट क्यों है? योर सर्टिफिकेट शुड से दिस इज टू सर्टिफाई दैट मिस ABC has been seen by us from this date to this date and is currently under treatment for her mental health disabilities or mental health difficulties.
Yes.
That's it. That is all that you certify. What are the difficulties? उसको डिप्रेशन है, एंजाइटी है, स्कूल को कुछ लेना देना नहीं है.
Yes.
She is on under treatment and she is under treatment in this hospital by hospital number so and so. That is it. एडमिटेड कब हुआ, क्यों हुआ, तो बाद में डिस्कशन होगा स्कूल में. अरे इसको तो मेंटल इलनेस है यार, उसको एडमिट किया था. Why do you want to reveal
Yes.
anything like that? You have to very simply say, person has been sick and has been under our care from which date to which date. And if she is currently on treatment, patient is currently on treatment and needs to be taken care of at home. Therefore, she will not be able to attend college until further notice. Finished.
Yes.
Sir, I had a question here. If the not particularly in this case, but if the absentee is longer, I mean The patient was really under us, admitted under us. So the school or the authority might ask that you could have attended the OPD, that like you cannot go to the OPD daily, so you should have attended your work or duty. So in that case,
She is under treatment, no? How she will attend? You are asking for workplace sickness, or you are
workplace,
attending a
yes.
school sickness.
Mean either of the two.
So if it is school sickness, the school is not really, the terms are not met.
Mm-hmm.
You can give a primary certificate, you can give an intermediate certificate, you can give a final certificate. In the final certificate or the intermediate certificate, you can say that so and so person who has been under our treatment has not recovered as yet, and therefore will require more time away from school.
Okay.
That's about it. And the last certificate says that now the person is sick, was sick from this to this, and now is fit to resume her classes. The school is requested to condone the period if possible. Condone, you use the word condone. Condone the period of absence so that the child can attend to her examination if possible. That now depends on the school whether they will allow or not.
Okay.
And
And
if it is work,
yeah,
then the same
yes.
process is supposed to be there. Okay, but the application has to be done by the patient.
Okay.
On the you write always, this certificate, last sentence is like this. This certificate doesn't carry any legal value and is being provided on the written application of the patient for his or her medical records.
Okay. Thank you, sir.
Are we for open questions? Yeah.
Siley, are you here?
You are here audible.
Saili is
Oh,
Saili.
sorry. Yeah,
Any
my
questions
mic
in the
was
chat
muted.
box, Saili? Any questions in the chat box?
Yeah, I'm checking
Mostly,
that, sir.
mostly, sir, it's a repetition of what we discuss here.
Ah.
I think most important thing in the chat box is my comment that this session should have been there for not only for the students but for consultants too.
Yeah.
Sure. If there are no questions from the audience, I'd like to move ahead and give a vote of thanks for this session. I sincerely thank Dr. Mishra sir, our president, for his insightful inputs and his constant support. Thank you, Dr. Gawande sir, for your continuous guidance, and the topic you have suggested was very much needed and insightful. Discussion happened today in this session. I thank our expert, Dr. Dume sir and Dr. Kumawat sir, for their valuable guidance and the insights they have provided for the certificate writing. Um, Student and us also have cleared lot many concepts and mm, the nuances in writing the certificate. Thanks to all the participants for their hard work and excellent presentation. I
And
thank all. Yes,
Siley, this time 78 students joined the program.
Yeah, that was
yes,
what great.
So
yeah,
78 postgraduate students, it's really creditable that this attendance is really, really good.
yes, sir. Yes, sir. So I thank all the attendants, all the people who have joined our session for today. Thank you all for joining and have a wonderful Sunday ahead. Thanks a lot.
Thank you all. Nice to meet all of you all. Thank you, Sushil.
Thank you
Thank
all,
you,
thank you
Sai.
all, and
Nice
happy
to
Thank
see
you.
you,
Akshaya Tritiya
Sandeep.
to all.
Yes.
Bye-bye.
Bye. Thank you.